Hi everyone, welcome to WomenHeart's Roundtable discussion. I'm Racine Tucker Hamilton, the Director of Communications for WomenHeart. I'm joined today by Dr. Sahil Parikh of Columbia University Medical Center and Maureen Mahoney, a heart disease survivor. Today our discussion will focus on peripheral artery disease. We will discuss its symptoms, treatment, risk factors, and prevention specifically as it relates to women. So Dr. Parikh, why don't we start with you? And just tell us, first of all, what is PAD and how is it different in women than men?
So peripheral artery disease is a disease of atherosclerosis, or plaque buildup of the arteries of the lower extremities. PAD can be manifest as different symptoms. Typically, patients would complain of pain in their legs when walking or doing exercise. But as with coronary artery disease, women often have atypical symptoms. In fact, at least half of patients with significant PAD have no significant pain in their legs. In fact, they may describe it as feeling a tiredness or a heaviness in the legs, or they may not even notice that this is related to the blood circulation at all.
And so, Maureen, why don't we have you talk a little bit and share with us your story, because you did experience pain.
I experienced pain. I'm a walker. So when I realized that I couldn't go more than, at the beginning it was a block, without pain in my calf. Then I started feeling a little, and so I went to the doctor, I asked, and I was told it was probably a muscle pull. So that was fine, you just go on another month with the pain, and then it would get substantially worse. So the time in between that, I would have it checked, and there was maybe arthritis, maybe I was given a host of different possibilities, age-related, and it wasn't until the pain started reaching up into my thigh, and then I noticed at night, if I put my foot up in the bed, or I would look down, there would be a complete discoloration. It would just be like no blood at all until you put the foot down. So then I would explain that, and then I went to a vascular surgeon, and after that I went to a cardiologist who was excellent and gave me ABI tests, and had a stent placed, 2 stents placed in my leg, and from then on I was back to normal, from before any peripheral artery disease. So I was fortunate in finding the cardiologist that would listen to me.
And what was back to normal for you? You said you were back to normal. What did that mean?
That I could walk a couple of miles a day and without pain. I didn't have any pain right after I had the stents put in. The first week or two it was slow. You just gradually increased the walking. But you knew that there was no pain the next day when you woke up with these stents put in. It was like a miracle. It was unbelievable.
And Dr. Parikh, why don't we talk a little bit about symptoms and risk factors and even treatment and prevention?
Yeah, so I think what Maureen's story tells us is really a classical story of the progression of disease. Many patients will have the symptoms that she had. It was a typical pain in the calf with walking, but many, as I've said, do not have any symptoms at all. But once the symptoms begin to limit your lifestyle or prevent you from doing your day's work, that's when it's really important to ask your doctor about the symptoms, and then also to ask about ABI testing. ABI testing is simply the ankle brachial index, or simply a ratio of the blood pressures in the arms and legs. It's a simple test that can be done in the office and is a great screening test for peripheral artery disease. If the test is abnormal or inconclusive, additional tests, including ultrasound or other tests, can be done. But really, the ABI is by far the best screening evaluation. The other thing to do is to know your risk factors. So patients who have high blood pressure, diabetes, high cholesterol, who smoke or lead a sedentary lifestyle are at risk for PAD. Particularly patients with diabetes or who smoke, those are at the highest risk for PAD. And any patient over the age of 50 who smokes or has diabetes should probably be evaluated for PAD if they have leg symptoms. Once we get older, both men and women, but especially in women, we should think about getting screening evaluation. And then if one is thinking about the natural history, few patients will go on, like Maureen, to develop symptoms that occur at rest, which is an ominous finding. And those patients are at risk for developing gangrene if they don't get treated. And so in those patients, treatment is a mandatory part of the therapeutic algorithm. On the other hand, patients who have symptoms that are stable, they should be treated with all the medicines that prevent progression of disease. That means they should take aspirin daily, they should take cholesterol-lowering medications, and they should take certain blood pressure pills that are also thought to reduce the progression of plaque. In addition, those patients should walk as much as they can. Walking has been shown to reduce the risk of progression of disease and improve the circulation. And those are really the treatments that should be used for patients before they develop severe symptoms such as Maureen. I think Maureen was lucky that she found the right specialist to take care of her. But if symptoms like this occur, it would be important, I think, to ask your doctor about the ABI screening test and to be referred to a vascular specialist.
Great, thank you so much. And Maureen, what advice do you have for other women, and what is it that you want women who hear your story to learn from it?
In a word, it would be diligence. You know, don't just dismiss this pain, especially as it's increasing or getting much worse. Just continue to try and find a professional who can diagnose and help you with what you actually have. Because that 8 months in between was forever, you know, in finding the cardiologist. That was perfect. You know, he was great, wonderful.
And Dr. Parikh, our research shows that a lot of people really don't know about PAD. And Maureen, you even said you had never heard
Not
of
a
it
clue.
before.
Mm-hmm.
Why do you think that is?
Well, it's interesting. You know, people know about heart disease. And the patients who have coronary artery disease, about half of them will have PAD and not even know it. So there's a strong correlation between PAD and CAD, or coronary artery disease. They are essentially the same disease affecting different parts of the body. Unfortunately, PAD is less well known, but when one is diagnosed with PAD, the risk of dying from heart disease goes up substantially, and the risk of a stroke goes up substantially. So the diagnosis of PAD is as important as making the diagnosis of CAD. So we are working hard to make people aware. Programs like this and others are trying to make people aware of the risk of PAD. And in fact, we know that if one were to have PAD, their treatment with medications, exercise, and lifestyle changes is more likely to save their lives than in other diseases.
And that's a great place to end. And unfortunately, we are out of time. And I hope that you all enjoyed learning these important facts about how to take control of your heart health, and specifically PAD and how it relates to women. And again, I'd like to thank our guests, Dr. Sahil Parikh and Maureen Mahoney. And if you'd like to learn more about women and heart disease, please visit WomenHeart.org.